Good evening. Thank you for coming. We'll start our webinar tonight. My name is Ann Phelan, and I am the Manager for Resources and Engagement here at the Perkins Transition Center. And this is our second transition talk for 2025. When we planned our talks within our team, we wanted to look at topics that were relevant to transition and that were going to provide you strategies and information and resources that would help you make decisions moving forward as you consider the next step into adult services and adult life for your children. We have representation from all across the country, and we're really grateful that you're here because we know that learning and taking time to absorb this information is a lot. So tonight, just come away with a few takeaways. You don't need to take notes. We will have the recordings available to you, and they will be emailed to you probably after the webinar sometime during the week. We do welcome questions, so please utilize the chat box. And if I feel that the question you ask is relevant to what our speaker is talking about, I will interrupt. But otherwise, we will have a Q&A at the end. So again, the Perkins Transition Center, we support all disabilities, and we really welcome you here tonight. So without further ado, we'll move forward with the slides. So tonight we're going to talk about healthcare transition and what to consider. So just one mention, N. Pickin, I was wondering if you could leave the Zoom and come right back, because some reason you're actually in the slideshow, and I love your name, but I'm going to ask you to rejoin us if you could. Thank you. What is healthcare transition? So healthcare transition is the process moving from pediatric healthcare to adult services, an adult model. And the goal of healthcare transition is for your adult children to be the lead in their decision-making as much as they can. We want to foster self-determination. We understand that communication needs and cognitive needs are all very different, but we really want our children to be involved in the discussions and forefront center in their healthcare. So why is it really important, the healthcare transition? Turning 18 is a big milestone legally, and we'll be talking about that tonight. Also, a healthcare transition plan really helps with the lifelong continuum as you consider moving from childhood pediatrics to adult healthcare. And we believe, and we also know that studies show that a coordinated healthcare plan does lead to a better quality of life. Also, a healthcare plan is important because it is equitable and it is respectful for the dignity of people. So planning ahead. So exploring healthcare options moving to adulthood is daunting, we know that, and you need to get educated. So tonight, we hope you do come away with some takeaways that will enable you to make some more decisions as you move forward. We know you have a lot on your plate in transition, but healthcare is important. So we also think that it's important to have a coordinated team, speech and language, OT, pharmacological support, psychologists, psychiatrists, O&Ms. It's just really important to have a whole team that's connected. But also we feel it's really important that your family members and your child's community are also front and center in the event that you're not able to care for your child and make those decisions. And we also feel it's important that you continue to advocate because sometimes our children cannot advocate for themselves. So some of the impasses to healthcare, we have to look at the reality, and we hope to talk about some of these challenges this evening. Medical providers, they're honest in their reports and surveys that they don't have the information how to work with our children. They don't have experience with neurodiversity or medically complex challenges. We do know that there are long wait lists. We know that there's a lot of frustration attributed to that. We know that our children have sensory needs and that waiting in a waiting room is impossible. Anesthesia is sometimes necessary. And we know that sometimes parents need to piggyback a lot of services in one appointment because anesthesia is a really big thing. We also know that our students, our children, are often not taught about their medical needs. They don't understand. They don't even sometimes know what they're taking for medication. Of course, ableism is present throughout transition, and we want to honor that the dignity of our children are really important. We know that our children need more time for appointments. We also know they have differing communication needs. Some are using augmented devices, some of them have interpreters, but these are some of the impasses. And last but not least, and this is a real big one, particularly with the neurodiverse population, those with autism spectrum, there's often a comorbidity, which means that not only do they have that diagnosis, but they often have GI issues, which is really present with people with disabilities on autism, and ADHD, anxiety, and seizure disorders. All right, so let's continue. Tonight, I'm very, very excited. Transition is an important topic, and one of the forefront resources for transition is Got Transition. And tonight, Peggy, I'm so glad you're here. There's your bio on your slide, and we just are excited to have you this evening. So I'm going to turn it over to you, and thank you for your presence tonight.
Wonderful. Thank you. And I can't imagine, I so appreciate you all coming out on a Tuesday evening to learn about transition. And I think it's a topic that more and more of us are talking about trauma-informed care, that it's very scary. And so I hope to give you more resources and also to encourage you to see the smiles in that first slide with young people really eager to learn more about their own health and advocate for themselves. So I want to thank Anne and Janine and also Elaine Gabovich from the Massachusetts Department of Public Health. So our work at Got Transition is, and next slide, is supported by the Lucille Packard Foundation for Children's Health, and I have no disclosures. And I just wanted to make a funny joke here. When we named ourselves many, many years ago, there was something out there called Got Milk. And so the group that was around the table thought, well, let's just say Got Transition. So that was the origins of our title. Next slide. So I think Anne gave you a great definition of what healthcare transition is, but I want to draw a particular focus on the second bullet here, that we talk about the ages from 12 to 26 as our transition age population, and we break the process of transition into three parts: the preparation, the planning, then the transfer of care, and the integration and retention into adult care. So anyone who looks at pediatric to adult transition has to understand it's a complex intervention. Next slide. So the evidence shows that when you have a planned process for transition, there are improvements in health, experience, and utilization of care. So, you know, that's really important for us to advocate that there is evidence showing that it makes a difference. And the Academy of Pediatrics, the American Academy of Family Physicians, and the American College of Physicians come together over the years to recommend that all youth with and without chronic conditions receive a structured process called the 6 core elements of healthcare transition. And that's something we at Got Transition helped to develop. It's a free, customizable resource, and I'll give you a little bit more detail about it. So it's a set of sample tools which lay out what are the basic parts of transition planning, transfer, and integration. And there are 3 packages: one for those who are leaving pediatric settings, moving into adult care. Another is for those who might be in a family medicine practice, who are not leaving, but they need to move to an adult approach to care. And the final package is for internists and family medicine docs and adult family nurse practitioners who are taking into their practice young adults. So I'm just going to go through with you what in the pediatric package. So the first core element is having a transition and care policy. And families tell us this is probably the most important thing because they don't anticipate what are the changes that are going to happen. So this is like a one-pager that would tell the youth and families what services they're going to offer for transition support, when the age of transfer will be. And it's very simple, but it's seldom provided. So, and the other thing that families often say to us is, it's very frustrating when you've got one, multi-physician practice, and one doctor will keep the patients till they're 30, and another one says you have to go at 18. And so the notion here is to create more consistent practice-wide policies. The second core element is to have the practices look at their patient population, who is in the 12 to 26 age group. And for example, if you've got a group that are 12 to 16, there's probably a certain set of the transition supports you want to provide. Those who are like 16 to 18, something different. And those who are really getting ready for transfer, again, something different. And then those 22 and older, you got to be saying, what are they doing in your practice? And so, not to say there aren't exceptions to the rules here, but we want to set up a system where practices are really looking at this population and making sure that they are supported in their transition. The third core element is a transition readiness assessment, and that is done annually to understand what a young person understands about their own health needs and how to use adult services. And so often families say to us, I had no idea that these were, we had hoped that they would be working with their young people around these areas. So that's a very important piece. The next one is transition planning. And this is putting together a plan of care, building on the transition readiness assessments and finding out what are youth's goals. And I want to put a big circle around creating a medical summary. The professional recommendations call for this to be done at age 14 and updated annually. And this is not an after visit summary. This is a concise medical summary that could be developed with the youth and families and also used to hand off to the adult providers. And all too often, what the adult providers say to us is that we receive the immunization records, but we're not receiving a concise medical summary. And they often say, we don't want a kind of a 6-inch binder of, the young person's full medical history. We want something tightly put together. And then on the transfer of care, that there be a complete transfer package, communication between the pediatric and the adult clinician, and confirmation of who's responsible before the initial adult visit for filling medicines, for taking care of acute care needs. Oftentimes, this is like a little bit of a desert that hasn't been worked through. And then the young person goes back to the pediatric practice and they say, you're no longer an enrollee here. So we want to avoid that. And then transfer completion, where you confirm attendance at the initial visit and elicit feedback. So our website, gottransition.org, has implementation guides for each of these core elements. And we've done readiness assessments for those with mental health conditions, for those with intellectual and developmental conditions, for special educators. So you'll see sample readiness assessments. We also have tools for measurement and a lot of information about in the research and policy page about examples of practices using the core elements. And again, I want to call out our tools that are available on our special education page and our mental health page and our intellectual and developmental disabilities page. Next slide. So I'm going to turn now to a family toolkit that we put together with our National Family Advisory Group. And it was co-produced with Family Voices. And I just wanted to call out the National Family Association for Deaf Blind, who was a participant in our group. We move on to the next slide. And just to let you know, this is a tool that organizations like Perkins and other organizations can use with their family advocates. And you may want to add some tools to it, but these are free resources available in English and Spanish. So we laid it out in a set of 10 questions. So I'll go through those questions now. If we move to the next page, the first one was, when should my child and I start to think about transition? And we have a timeline there. If we could go to the next page. Yeah. And so this starts at age 12 to 13, when you're encouraging your teen to ask their doctor questions about their own health, and encourage at least some part of the visit with time alone with the clinician. That has been shown to really build advocacy skills and independence. Following that, we have the encouraging over time the teen taking on more responsibility for making their own appointment and ordering refills of their medicine. Again, building skills in a safe environment, and making mistakes, but with backup. Next one is, I mentioned earlier, work with your teen and doctor to make and share a medical summary. That's around 16 to 17. And then most young people make a transfer between 18 and 21. And I think it's really important to think about the challenges right now. There's a lot of shortages in the adult primary care workforce. And to the extent that you can allow enough time to find a new adult provider is critical. And that may be a year, maybe 2 years, but don't shortchange this time, or don't wait till it's, your child is off your insurance and you're moving them when they're maybe not insured or whatever. So I'm just saying that finding this new adult doctor can be very challenging, and so allow enough time for that. And then oftentimes young adults, which I'm certain I'm not telling you anything you don't know, don't continue with the doctor. So they might go one visit, they might not be thrilled with it, but then they don't follow up finding a new doctor or continuing with that doctor. So it's really, really important that this kind of retention in adult care is important. And we often say that the skills in building knowledge about their own health doesn't end at age 18. It is a kind of a lifelong skill. Next question. What are the recommended healthcare transition services? Again, I referenced the clinical recommendations that were called for by the professional organizations. And then we attempted to put them into practice in the 6 core elements. And though those are intended for clinicians, they are, I think, very important for families and young people to look at. Because we know that about 4 out of 5 young people with chronic conditions are not receiving transition support from their healthcare providers. So bringing this to the attention of their healthcare providers, whether or not it's a transition readiness assessment that you completed, or the beginnings of a medical summary that you'd like to do with the physician or nurse practitioner would be great. Next slide. So about questions to ask your doctor about the transition to adult care. Again, these are just examples from the family guide. For parents, at what age does my child need to move to adult health care? And then, do you have any suggestions of adult providers for my child to transfer? And then during the adolescence, again, we find this is a very critical piece. When do I start having at least some time, part of the visit, to meet with a clinician on their own to discuss their health and health care? And then learning more on the adult doctor side to find more about whether or not they accept your insurance and require payment at the time of the visit. Next slide. So the changing role of the child and parent is quite can be quite abrupt, and we're all about aiming toward making it not abrupt. And so if we could talk about that, you know, early on, the parent and caregiver was really responsible for overseeing the care for the youth. But over time, you're wanting them to be the consultant, and then eventually the young person would be the leader of their own care. And again, I understand that this varies depending on the young person's health conditions, but it's something that I think a lot of families are afraid about the changes, and hold on to the control of the care. And in the end, sometimes it's a disservice to the young people. So it just, again, it's a tricky balance, but to the extent that it's possible to build this over time, it's a great thing. And I don't know if any of you have heard about charting the life course. It's a set of wonderful resources for individuals who have intellectual and developmental disabilities. And they have if we could turn to the next slide, a great chart called, it's around decision-making supports. And you can see it looks at various aspects of decisions that can be made: daily life, healthy living, social and spirituality, safety, community living, citizenship. And then for each one of them, the individual or family would fill out, I'm not reading this. I can decide with no extra support. I need support with my decisions, and I need someone to decide for me. So it helps to kind of be more specific about where the help is needed. Now, the next slide on legal changes at age 18. There are many, many, many. And again, I think if any of you have had kids in college, you understand the grades go to the student, not to the parents. So the clinicians are really encouraged to speak with the patient, not with the parents. And that is for many a shock. And their health information and medical records are private unless they give the okay. And if a young person needs help making decisions, it's important that they talk with their clinicians about this and what would help to make this work better. Next slide. And the differences between pediatric and adult care, my colleague, Patience White, who is on this call, I can see her, she often has to get in the middle of discussions between pediatric providers and adult providers, and often says it's like she should have gotten a family counseling degree or marriage counseling. But it's really important that on the pediatric side, that they don't vilify the adult clinicians, like nobody can care for you as well as I've done, or pediatric practice is the gold star. I think it's important to recognize that there are two very different systems of care, and the adult systems have far fewer resources than those on the pediatric side. And so again, to acknowledge that you're not gonna, if you miss an appointment, somebody's not necessarily gonna call you up to remind you, et cetera. So just to recognize that there are substantial differences, but the vast majority of adult practices care for those with chronic conditions. So while they may not be familiar with some of the childhood onset conditions, they do have a great knowledge about care of chronic conditions. Next slide. So this, getting to the transition readiness, if we could go to the next slide. And this is part of the 6 core elements. We have a one-pager that can be filled out. This is the one I'm showing you is on parent and caregivers. We have one for youth and a self-care assessment for young adults. So you basically look at how important and confident you feel about the move to adult care. And then there's a set of questions about your health and your child's health and health care, and whether or not you'd like to learn something more about them or not, or yes. So again, I mentioned the implementation tools we have. The guide has a lot of other sample tools. So if we move forward, this is again a sample, a transition readiness for those with intellectual and developmental disabilities. And then on the fun side of things, we have the next slide. On the website, transition quiz that a lot of young people have found to be fun, and we encourage the visiting for the youth and for the parent and caregivers. So next slide, I want to encourage you to check out our website. We have resources for parent and caregivers, for youth and young adults, and for clinicians and researchers and policy advocates. And next slide. Here are some of our most popular resources. We shared with you the family toolkit, but there are others that I think you might find helpful. And then on the next slide, we have additional resources. And I just want to call your attention, the Center for Transition to Adult Healthcare for Youth with Developmental Disabilities, with a group of young people with intellectual and developmental disabilities. We created a website, and it's called movingtoadulthealthcare.org. Again, a lot of nice resources for youth and families. And then on the next page, we have, thanks to our colleagues at the Massachusetts Department of Health, a set of Massachusetts resources. This is the first one. Is there a lot of general information about transition in Massachusetts and their care coordination resources. And the Boston Children's Hospital has done a lot of work over the last 3 or 4 years around transition for youth with developmental disabilities. So I just wanted you to see those resources. And I think that's the end, and I'm happy to answer any questions that you have. Thank you.
Thanks, Peggy. I did put a link in the chat box that refers to a 4-part series we did on legal decision making. And so, Peggy, when you were talking about the turning 18 milestone, we're specifically talking about parents who are making decisions, and that could include a healthcare proxy, perhaps. It could be supported decision making around legal and medical needs. So please reference that. That was a really important 4-part series that we talked about that. Yes, Katie, we'll send you the slides. Janine will send those out this week, so you don't have to take copious notes. Audrey, who's in the healthcare field in California, we're really grateful you're here this evening. So before we go to Q&A, I did cite an article that's a little wordy, but really what I want to highlight and spotlight is that with the 61 million Americans in our country with disabilities, we do know that there's increasing evidence that physicians are admitting they do not have the expertise and the skills and understanding. And this is something that they're not really addressing in the medical schools, apparently. Perhaps there's a bigger trend coming up. But that's why it's so very important that parents advocate for their children's needs. And I know that it's just another layer of work that you have to do. Fortunately, in the state of Massachusetts, we have quite a few resources. We have Children's Hospital, we have the Laurie Center, we have Boston Medical Center, Mass General. We're really fortunate. But even in our state, I think parents who can chime in tonight in the chat box, even in Massachusetts, people are reaching big impasses. So we are here tonight to recognize that and support you. I could talk about this all night, but I want to go to Q&A, and feel free to type in your questions in the chat box. Also, if you want to tell us what state you're in and if you're needing help, Peggy and I would be happy to connect with you after the webinar, or perhaps offer some suggestions this evening. We do have a heavy presence tonight in Massachusetts. We're grateful you're here. Thank you so much. Earlier, I had spoken about bundling healthcare. So Peggy, I don't know if you're familiar with this, but let's say your child has a aversion to teeth cleaning or dental care. I think most of us do, but particularly with people with neurodiversity and sensory issues, there sometimes needs to be anesthesia involved. And so sometimes parents and healthcare professionals are bundling other types of assessments, perhaps some blood work, podiatry care. So that's something that some parents are working with their healthcare team on. Also, really informing your healthcare provider about the sensory needs. Perhaps you needed extended time. Maybe there needs to be a different waiting room area. There's so many things that we could talk about tonight.
Yes, I think that I want to again highlight the importance of the medical summary, that this is an important spot to put that information in. So that the future providers have a better understanding of what works and what doesn't work. I see my colleague Patience White, who advises people all over the world here. I'm just wondering if you want to say anything about the kind of managing multiple transitions when moving from, for a young person who is seeing both a primary care and maybe numerous specialty providers.
Well, you bring up an incredibly important point, because almost everybody, particularly youth with special needs, have lots of physicians and lots of people that are helping them. And it really have to think about staging it over time. You certainly don't want to do it all at once. And most people think if you can find that primary care, the person that's going to really help you be the sort of the medical home, as we call it, or the place that will keep all the information, work on that first. and try also, we're try to help people to think through that you want the condition to be as stable as possible. In other words, you don't want to suddenly move to a new provider when you have an acute medical problem going on at the same time. So waiting for that moment where things are relatively smooth. I always say relatively because it's never perfect. And then map it out. Say I have 10 things that people that I interface with, whether it's any kind of durable medical equipment, whatever it is, think through it and then march right through it. But ideally starting with somebody like a primary care physician on the adult side who can help you sometimes identify some of the subspecialty resources that you need. So I hope that's helpful. Thanks, Peggy.
Mhm.
And I would like to introduce you, Dr. White. Dr. White is together with you, Peggy, at Got Transition and so many other places. We're really honored to have you here, and I'm so grateful you chimed in because your experience in healthcare is vast and wonderful. So thank you for that. And I really encourage people tonight to ask questions because we have two incredible experts here, and this is just a gold nugget for all of us. Thank you. We had a question about healthcare needs in Illinois. If you could type in the city in Illinois you're in, and we might be able to kind of specifically think about a resource for you. Thank you, Christina, for sharing. So you're in Massachusetts and you're in the Mass General healthcare system, MGB, Mass General. And you're living in Newton. We have our resources in the end with our contact information. If you want to privately reach out, we'd be really happy to help you. Julie, Chicago, oh, wow. I'm surprised that there's not some leaders in this, but I'm not surprised as well. Maybe Dr. White or Peggy have some resource ideas for you in the Chicago area. Otherwise, feel free to reach out after this webinar and we can certainly help you take a deeper dive into that.
Yeah, I would suggest the University of Illinois at Chicago. They run the program for children with special needs in the state, and I think might be of assistance. So it's the University of Illinois at Chicago, and it's the program for children with special healthcare needs.
Also, Lurie has transition clinics and some physicians that are very interested in healthcare transition. So that's another potential resource.
Patience, I'm wondering if you could just say a word about the differences in the adult side about the importance of primary care as the kind of the foundation piece versus the specialty care, which is often the foundation piece in pediatrics.
You know, Peggy, you brought up a really interesting difference. In pediatrics, often the subspecialty physicians tend to almost be that focal point, that primary care. And that's not the case on the adult side. The specialists pretty much, and I'm both a pediatric and adult provider, I really want somebody to see their primary care provider. I will not have behavioral health in my subspecialty office or a variety of things to manage other aspects of somebody as they age. And that you're in the adult system, probably, hopefully 50, 60 years. In pediatrics, you're there for the first 20 or 30. So thinking about trying to find that primary care sort of focal point person in the adult system is very important. It's not that it's not important in pediatrics. It just turns out that often the subspecialty provider in pediatrics tends to take that lead. And so people often don't see their pediatrician very often. They're really seeing their subspecialists more frequently, whereas that's not the case on the adult side.
Peggy, we had a question, which is excellent. If you have a child with medical complex needs and the assessment tools, are there any that are more geared towards a real medically complex who will be needing 24/7 supports for their life?
I think that that it would be useful to look at the tools that we have for those with intellectual and developmental disabilities, because they're include more resources. Patients, I don't know if you think that there's other ones that other complex care centers have used.
Yeah, I mean, I think if you're in a complex care center, they may well have an assessment that actually families fill out, and you could do that. We have one as well, thinking about some of the things that you're going to need to make the changes around the young person if the young person is not capable to doing it themselves along the way. So I think hopefully whoever asked the question are part of a complex care center. And a lot of them have worked hard at trying to think about the needs that have to be transitioned into the adult system.
In segueing there, I think it's important if you are the guardian, it's important to include another family member or someone else in your community on all aspects of the healthcare transition plan, because there might be a day that you're not available to do that. So having a really thorough documentation is really vital. My question is about involving our other adult children in this process. One is the guardian. What is your experience, recommendations on getting them involved, especially as we get older? Such a great question, Mike, and that's kind of what I was just alluding to. I think that it's important that they have access to the information. Patience and Peggy, any other suggestions on involving other family members when the parent is the guardian?
I'll turn to Patience on this one.
Well, absolutely. I must admit, on the adult side, I often have a brother or a sister who then has taken over the charge of being the guardian of the now a young adult. And so I think it's important if you can involve your other children when the time is right. I think this is hard. They have to grow up too, and you want to be sure it's the right time that they can be involved and begin to think about these things. If you being the guardian have somebody else in the family that's outside your family that is perhaps a little bit younger than you that is willing to step in during this time, I think that's important. People need support. They need respite. The more people that you can help you give the best care you possibly can to your young person. But you don't want to put too much burden on the siblings, I think, and too early. I think that's a really important thing. You know your children, you know their capacity, and so you want to be sure that they have a chance and not feel burdened with their sibling too soon.
We actually have a half-day transition symposium in Watertown on May 17th. And one of our guest speakers will be from Mass Siblings, and we'll be talking about the sibling experience. And what Dr. White just said is so, so important, that I've spoken to family members and siblings who are scared and they don't want to discard the responsibility, but it's overwhelming. So it's a really important topic, and I'm so grateful that you brought that up. And Diane, from the Federation, we're really grateful you're here. Please add your resource, Diane, because the Federation here in Massachusetts is such an important agency for all of us. But supported decision making, this is a movement across the country. I think that I read there were 20-something states now that recognize that supported decision making, which means the decision maker is the adult child, but they have a team or individuals who help them make the decisions. And sometimes parents are looking at going away from guardianship. And we did have a 4-part series where we touched on that. So I did put the link in the chat box that you can access that. And there are webinars all the time on supported decision making. And I really honor that conversation, because we do want to go with the least restrictive options for those decisions. And Diane,
And
oh, go ahead.
I think, Ann, you're pointing out also just the complexities and Patience was talking about the layering of all that goes on here. And I think that was the intention of these professional guidelines to start early at 12 years of age and continue through 26, recognizes that there is a lot of building to happen. And so, to start this work a year before you're transferring puts everybody at a huge disadvantage. And so again, we want to leave the message that it's really important to think about the core elements and to plan well in advance and not push too much on the family or the young person all at once.
Any last questions? We can take those on in the chat box, but I think for now, Peggy and Patience, it was a treat to have both of you. We met last fall, and coming together here is so important. And this conversation will continue. And when we go to the resource slide, please do sign up for the newsletters and information from Got Transition. We do have some other professionals here. If they want to put their contact information, we have Kim Delano from Maine, and the Federation's here, and Audrey from California. So thank you all. And really, most importantly, give yourself a pat on the back for being here, because this is such an important topic. We do realize it's late at night. So tonight we just want to continue with a few more slides. Okay, so Life Launch, let's talk about this. This is a new program that's slated to start in July. And this is a residential transition program for 18 to 22-year-olds. We're really excited about this. We do know that transition programs are so important, leading to better transition outcomes. There's a whole curriculum. We'd love to talk to you about this. If you take your camera, you can scan the QR code and have an info session with one of our team professionals to learn more about this. This is a 766 program, which means it's a tuition-based program, and we're really excited about it. So after this, you might say, I really need a little bit more help. And we do have transition support for you. And that would be with a member of our team in the transition center. It's all individual. We offer initial consultations for free, and we provide empowerment and consultation and resources. And we just are here to continue the dialogue. And we have a Facebook community. There's a QR code that you can snap on that. And these questions you're talking about and anything you have, we invite you to bring those to the table in the transition talks, because other people will learn from you. But also, you have information, they have information you can glean from them as well. Here's our contact information. And thank you. We have another member from the Federation, Megan Chapman, our Family Engagement Employment for People with Disabilities. So there's her contact information. Thank you. Thank you, everybody. We're getting out of class a little early tonight. So thank you, Peggy. Thank you, Patience. And thank all of you for being here tonight. Good night, everyone.